the aged. So when someone is about 50 or 60, and we thought that these are diseases that come because of old age. However, today things have changed, that even young ones have the same diseases. So we are going to look at the prevalence of and the burden of these heart diseases, or the ones you'd call the cardiovascular diseases. Of course, we have the commonest that we know, hypertension, but there is more than hypertension. The heart diseases are quite many, and that is what we want to understand today. Why are they increasing? Because of recent we lost even a minister, and they tell us she died because of a heart attack. So really, we've lost very many people, very many important people in this country. In your family, you might have lost someone who is really very, very important. It's unfortunate, but all is not lost. There is still hope if we do what we shall talk about. Therefore, join me as we welcome our guest today, who is going to take us through today's discussion. This is none other than Dr. Tumuhairwe Boaz. He's the Managing Director of Gifted Hands Hospitals Ltd. Why Gifted Hands? Are there hands that are not gifted? Anyway, he will tell us. Doctor, it's a pleasure having you this evening. We are delighted to have you.
I'm also delighted to be here. And it's really a pleasure.
Yeah.
I was really welcomed very well.
Wow.
I like your motto, enriching lives.
Indeed.
It's really something that's really touching. Thank you so much for giving me this opportunity to talk about this silent killer.
Yeah.
You really gave the viewers a preamble which was really adequate enough for really to understand exactly it's really a silent killer. And I will explain further why it's a silent killer.
Indeed, we are delighted. But before we even get into the silent killer, you know, we don't want to start at the bad note.
Yeah, sure.
I want you to tell us about Gifted Hands. Why Gifted Hands?
Yeah,
and probably you'll tell us whether the hands that are not gifted.
Yeah, sure.
I would be there with hands that are not gifted.
Truth be said, Gifted Hands, it's a name that really holds a lot of matter to me, and emotions, because of the kind of background of my medical education I went through to reach out medical school. It was a hurdle, but later, by God's grace, I managed to finish medical school, and through why Gifted Hands, I was inspired by Ben Carson's book, who was one of the dumbest child in US and came out to be the best neurosurgeon that we really hear about, talk about. So through the same inspirations, I had to commit myself to make up a hospital and a company called Gifted Hands. Yeah, so that's why Gifted Hands it came to existence, and trust me, it's really doing its work as its name. We really try so much to serve our people beyond their expectations, with love, passionate, and also putting God ahead of everything. Yeah,
that's really interesting. Now, we get to our topic. We want to look at the burden of heart disease and why it is growing. But I think to start with, you know, when we talk about the heart, there are a lot of stories around the heart.
Yeah, sure.
Because someone will say, when I touch here, I feel my heart pumping. But then someone who comes crying because of a heartbreak also says it is the heart that has been broken. So we wonder, where does the breaker find the heart? Tell us about the heart.
Yeah, thank you so much. I like the way you brought it. People here, there's a little word I always say, omenye umutima. So surely it is something that we actually, normally, putting medical things aside, we realize what this omenye umutima, why? It's really one of the most vital organs we have. Now I think
because there's no one who says omenye omenye chibumba. I mean,
now whenever the heart goes to silent, life goes. Whenever the heart stops, life goes. So our grandees, people who were there before us, who probably did not go so much deep into medicine, realized that this part must be an important part. Every time somebody disturbs you and you feel you're too much stressed, it increases. You say, my heart is going to, or omenyo mutima, that kind of, just put in quotes, like you're breaking my heart. So, but scientifically, the heart does a different part. It's not about love. It's not about. It's not about emotions. So, the heart is basically an organ, like any other organ. As we have the brain, as we have the lungs, as we have the kidneys, as we have the urinary systems, on all other organs. So the heart is also part of it. But its vital role is to pump blood to reach every part of your body. Why pump blood? Why? Why is it really important? I want to emphasize it, that every cell in our body, be this finger, be the toe, be the hair you think that actually does not really have any role it plays on you, that we cut every day and maybe we shave. It requires nutrients. Go eat our food, eat your chicken, eat your kaunga, eat your whatever. That food, it's broken down in the GIT, in the digestive system, but it ends up in blood. Now, the blood works as a transporter of oxygen, of nutrients, and even water. Everything, all nutrients we have in our body go through blood. Now, there's an organ saying that, no, me, I'm there to give you energy to reach where you want to go. So it helps to give transport to reach this last part of your body. Now, when it gets issues, the whole body goes to a mess. All organs go to a mess. That's why today, Family TV said, Dr. Boaz, come and tell us about the cardiovascular diseases, come and tell us more about the heart. So when we talk about the heart, we're basically talking about the cardiovascular system, just to be specific. There are very many systems in the body, but specifically it's the cardiovascular system. Cardio meaning the heart, vascular meaning blood vessels. So as we talk about cardiovascular diseases, we only do not talk about the heart alone. The heart alone does not work independently to serve the body. It has what we call vessels, which can be like, we call like roads. I always tell people that there's a driver of a taxi and a road. So if that truck driver is not driving the taxi, it will not move properly. It will not move. So the road itself, if it's not well, in good conditions, like potholes, trust me, people will take long to reach Family TV to serve people. Why? Because the transport media is not really proper.
People around Kampala should be knowing this very well now. Very, very, very.
Actually, I'm trying to talk to the lowest person actually to understand what you're talking about. Now, in the same process, we are going to tackle very many diseases. I will just go through them, peruse through. But you're going to allow me tackle the most killer, the most cause of all these problems, which is hypertension. So, basically, cardiovascular diseases are diseases that affect the heart and the blood vessels, as I already said. There are very many in number. I'm going to just peruse through most of them. I'm going to be dividing them according to how I divided the cardiovascular, vascular, and the heart. Vascular, we talk about diseases that affect blood vessels. A blood vessel can get a rupture. You can just be there because of an accident, blood vessel ruptures. When it ruptures, it allows the most important part of our body, we call blood, that holds everything we've eaten to peruse through into the ground and to the environment. At the end of the day, the cell that is waiting for it to serve you, to make you think, to make you move, to make you other organs work, is not really getting that. That's actually an accident. Now, the other is what we call DVT. This is what we call deep vein thrombosis. That's where clots form into veins and clog backflow of blood back to the heart. Now, as the heart pumps blood through the major blood vessels, the aorta, down to other blood vessels, it has to go back to the heart to receive more oxygen and nutrients. Now, nutrients actually basically gotten from the digestive system. The heart basically does the pumping part. But as it's moving, it has already delivered the nutrients. Now, a free taxi is going to pick other passengers. The blood is the taxi, going to pack other nutrients, oxygen and others. Now, in the process, somebody puts a roadblock. That's a clot. A clot goes onto a blood vessel, it seals, and little blood or no blood reaches the heart. In the process, the heart will try to do all it does to make sure it gets what it's supposed to, it's what it's expecting. In the process, there was somebody will come telling you, I'm feeling pain in my lower limbs, in my legs, mostly the calf. In Uganda we call it entumbwe, in Onyanko we call it okuguru, things of that kind in other languages, but what I mean are the calf muscles. Those are the most areas that really suffer DVT. The lungs, you've heard of people who are climbing stairs, very healthy. Somebody collapses, and then it's gone. Why? Pulmonary embolism. A clot moves through all those blood vessels, keeps on moving, it reaches small blood vessels in the lungs, it cuts off blood, blood supply or movement of blood within the lungs to correct oxygen, and somebody gets what we call syncope or then faints. By the time they reach they reach a hospital, sometimes it's already too late. So it's really a big concern that really need to be addressed. There are other infectious diseases that affect the heart and the blood vessels. Sometimes we've heard of this called pericarditis, where the infection accidentally, not accidentally, reaches either the blood vessel, reaches the layer that covers the heart, we call the pericardium, and it inflames it. Every time you hear something like carditis, it means there is inflammation. Now, there are specifically organs we call the streped viridans, that basically when they reach that area, they destroy it, it becomes fibrosis. By fibrosis, it gets inflamed, starts paining. Now, in the process, it also swells.
Are these the people we hear being diagnosed and they tell them that omutima gwo gwazimba, something like that?
Yeah, not really as say. That one will come in another kind of thing I'm talking about. Here, infection, either through a tooth extraction that was poorly done, there was an abscess, there was pus, and because of a reckless or maybe a health worker says, no, let me go in. You injure blood vessels, infection spreads through those broken blood vessels. Infections, remember, blood vessels connect directly to the heart. Then you find that you get a heart disease, which is an infection that actually either through poor dental oral hygiene or health, an abscess in that kind of manner. Some people go through heart surgeries. In the process of going through heart surgeries, maybe due to contamination, infections come into the area, and as they repair, later somebody, as they're healed, they have pericarditis, they have effective endocarditis, they have, and other forms of all infections can happen within the heart. But that is through infection. Another thing is trauma. You can be driving, this still goes to caution mostly the drivers. Those seatbelts which were put there were not put there for formality. Ladies and gentlemen, put on your seatbelts. Once you get a head-on collision when you are driving, the first thing to suffer trauma is your chest. And the chest holds important organs, and one of them is the heart. Now, when you get an accident, the first thing is to move. Inertia takes you in front. As it takes you in front, your heart hits the steering, the chest hits the steering will hit basically around the chest, the ribs, around the 4th, 5th, and the 6th intercostal spaces. Those are the areas where the heart sits. And when they are damaged, your heart can easily get damaged. And when it's damaged, it can just stop. I told you it's covered by a very strong layer called the pericardium. Now, the heart is very delicate. It has blood vessels we call the coronary arteries. When they break, they start bleeding within. The other layer does not break. Now, we call what we call the cardiac tamponade. Tamponade, blood fills the car. I'm going to use the cavera language so that people can understand me. The pericardium is like a cavera. So it's a cavera where the heart sits. Now, remember, these blood vessels are surrounding the heart. Now, they are broken. Blood gets full into that cavera, and now it doesn't get space where to pump from. It stops. When it stops, trust me, we believe God works, but it must be beyond a miracle for you to survive that. You may not survive it. So please, ladies and gentlemen, put on your seatbelts. It's
not
very
for
important.
that traffic officer.
Not for the traffic officer. Don't overspeed, take caution when you're driving, but put on a seatbelt.
The passengers should also be cautious, especially when you realize that the driver is, especially if you're in a public transport and you realize that driver is driving recklessly. This is your life that they're playing with. So be cautious as well. Yeah, sure. So it's really important as we really emphasize it. The other thing is tumors. Tumors, cancers are really on the rise these days. But mostly cancers of the heart are not so common, which are primarily originating from the heart. Most of them that really go into the heart are metastases. They originate from any other areas, but because blood is moving all over the body, it keeps on getting seeds from wherever, either the prostate or the ovaries or stomach or whatever, or lung cancer, and it's implanted sometimes into the myometrium or muscles of the heart. But it's a rare condition that we don't really see most times. There are autoimmune diseases. Autoimmune diseases meaning the body fighting itself. Yes. And it's also a common thing if you really want to know about it. And this time I really take a lot of emphasis to mostly parents who their children suffer a cough and they take it to be slight. No, it will be okay. We are Africans.
Africa, yes. Like it's okay. It's going to be fine. Everything, as long as there's no pain, everything is fine. We only respond to pain. It's a hazard that has killed most of our sisters, most of our brothers, most of our parents, and that has really put most of the young generation that would be contributing too much to the building of this country to a stake and actually going backwards. Coughs, the strep infection, when the body reacts to it, it has sometimes similar proteins that resemble the myocardium or the muscles or the cells of the heart. Now, the body will be doing its work to fight an infection. Now, in the process, as it goes on, it will realize, find something that tries to mimic the infection it has been fighting in the throat. 2 weeks down the road, somebody will come and realize, hey, he has a heart disease. Heart disease from where? But the doctor will ask you, did you suffer from a cough? You ask, look at this doctor. A cough, and I'm telling you I have a heart problem. I'm telling you I have a cough. But there's a big relationship, and that's how it is. Secondly, introgenic, some drugs also cause heart diseases, but very few of those. Neoplasm, I talked about cancers already. Yeah. I'm going to also emphasize on the social aspect. Social aspect whereby stress is killing our people. Hypertension is on a rise because of no hope. But I'm so glad that religious TVs like Family TV has really built hope into people. Thank you for enriching lives. I'm really saying it from the bottom of my heart. Thank you for enriching lives. Thank you for giving people hope. Thank you for showing that actually even all when things fail, God is still there. Now, we are in a society where stress is normal. And nobody's addressing it. And still this is a weakness that even is actually within even the public sector. I want to tell you I happen to work with cases here. I happen to work, I've been to Mulago, been to all other facilities. But you realize that the psychiatric department is one of the least staffed department. It's not actually, it's like a pressure, but people are suffering stress. And when it comes to a man gender, a male gender, trust me,
Society has made us believe that a man is strong, so no one really minds about a man and what they go through.
Exactly. And I really, trust me, men are dying silently. Male who are around there, please, when you don't feel it's okay for a man to cry, it's okay, it's fine. When you feel you're really distressed, it's okay, go find a friend, tell the man, this is killing me. You never know, he can tell you 2 words that will bring hope back to you. As you try to rush through this, I also want to tackle something that's very important that is also killing our society and causing cardiovascular disease to go on a rise. Alcohol. Alcohol is a big burden. And when it comes to the young generation, Kudugazemeza is a everyday thing of the day. Whenever you find that, like when the table is not yet dirty, nothing has been done.
Even songs that
yes, that accompany them, say they cheer them up, and you feel like everything is okay. But trust me, you are bringing death closer to yourself. Alcohol is really causing a big burden to people. Alcohol, most people always ask me, health workers, you always fight our things that make us happy. But the truth is, alcohol has a relationship of making blood vessels harder. Now, when they become hard, if you ever pushed anything through a pump, when the thing is hard to go, which blood vessels are supposed to be elastic. When the heart beats, they should allow that pressure. Then again go back and press blood to continue. Now this time, the heart is hitting on the hard thing. And the process, it gets sick. Something you talked about, cardiomegaly, the heart becoming big, becoming weak, and in the process, we get heart failure, we get strokes, we get all other things that come about. Please, ladies and gentlemen, alcohol should be used responsibly. Do not really think I'm really actually fighting it. Some, you say, Dr. Okubia, you are beating so hard on that. But please, lady and gentlemen, I'm here to talk about life and saving life.
Doctor, at that point, let's take a short commercial break. When we return, we are going to continue from there. It is really important that you keep through as we come back. Thank you.
Coming soon on Church of Uganda, Family TV.
And by that time, Uganda had a problem of sacrifices. They would sacrifice people, animals, and the king was interested to see where someone can go to worship without offering sacrifices of human beings.
For a long, long time, Bunyoro was an archdeaconry, including Masindi Kitara Diocese. We were one archdeaconry.
The chairman of the building committee was the then Catholic of Uganda, Sir Apollo Kagwa. And it is very, very interesting to see that the indigenous people here wanted to build a building without any help.
About 3 or or so weeks ago, we lost someone very important in a family setting, and he was on a wedding. Of course, the family members watching, they could be knowing about this. They know about this, not even could be. They were on a wedding, and as he was in the queue of getting food, they just saw him falling down. But now, the close people were saying 2 days ago, he had just taken his blood pressure, and it was normal. So to them, it was hard to convince them that one of the causes of his death was blood pressure. But now from this discussion, we realize that there is a lot more than actually blood pressure. There is a lot more that can cause your death, especially when it gets to heart diseases. Today we are looking at heart diseases, and I want, by the end of this show, I pray that you will have picked something that will help you and your family, especially in the road of health we are in, because at the end of the day, we need you healthy. Let me tell you, when you are healthy and the burden is low, the government will also save some money to do other things. But think of how much money will be spent or is spent on attending to most of these diseases. To be specific, if you go to the Heart Institute, that is when you will know that the burden is really very, very high. And that is when you will know that it's really very, very serious. Doctor, yes, before the break, you had actually brought in something to do with alcohol, and you had really explained what alcohol does, yes, and its relationship to the heart diseases. And that is why I cut you short from, because we had to take a break.
Thank you so much for this. Again, bring this concern back, because it's a public health concern.
Yes, people drink recklessly.
And it's, for some reasons, people use alcohol as a measure to fight stress.
Yes.
And I want to really take time now, as I look at my viewers and viewers of Family TV, that you cannot run away from your problems by trying to forget them. It's not possible. Now, what is just happening is the alcohol trying to deceive you by raising some of the neurotransmitters in the brain, or some chemicals in the brain. I'm going to use that word for people to understand me. What we call dopamine, that brings excitement. After taking 1, 2, 3 beers, you feel, okay, I'm becoming high, I can laugh. The problems are no longer to be where. The reason is the brain is a CNS, the alcohol is a CNS stimulator. It makes you happy. But at the end of the day, it will put you down. And it's putting you down causes all other complications. Complications including kidney disease, complications risking you to cancers, throat cancers, risking to cardiovascular disease, the topic of today, which is a very big problem globally, Africa, East Africa, and Uganda. As a few statistics I'm going to give you just in a few minutes to come in. Now, let's find real ways of how to solve our problems. Because running away from the problem doesn't mean you've solved it.
Exactly.
So alcohol does not even do 1.00% to solve a problem. If it is school fees, you take it today and you get drunk. In the morning, they'll still funk a bank slip waiting for you when you're dining. So, without wasting time, let me leave that. Please make sure alcohol shouldn't really be a killer. Leaving people orphans, leaving people, the country losing its precious brains, like the important people are losing in such a kind of manner as an abrupt death. It's really, really so common these days. And it's becoming a concern, mostly in Uganda. Just by last year, we had a prominent politician who was just seated in a wedding party. As he was seated, he just started sweating from nowhere. People in Liantonde and Chinunka, where he come from, know him. He was a prominent person. I will not speak the name because of ethical conducts. He started sweating from nowhere, and from nowhere he fell down. Just in a few minutes, they were trying to carry him to his car. It was gone. Why? People, I realize that sometimes we, the health workers, have not really done adequate of what we're trying to do. I would also say the media should also put more emphasis on public health. It's very, very important. And also our leaders to also put more emphasis on making this awareness to the communities. Because trust me, most of us, it's because some of us are health workers, but people who are out there, they have nothing to know about this.
Exactly.
They have nothing to know about. So it's actually awareness that brought them that actually will tell all this.
Yes.
Behaviors also do this. In one way or the other, you find that actually you are praised for causing stress to people. One thing I'm very sure, the Bible says it, that it's you reap what you sow. Now, you are causing stress to others, and you think for you move, and everything will be, it will be grace and everything to you. Never. Live in a non-toxic environment. Live in a happy environment. Live in a place where actually everything, all of you, it's family, it's okay to be okay. Lift somebody's hand. Give people hope. Give people, help others, so that you don't have such a kind of issues. Most behaviors, bad behaviors, will come with bad results. Now, and I told you that stress is one of the risk factors. Congenital diseases, you've heard of people who are born with congenital heart defects. They have holes in their hearts or in their blood vessels, and at the end of the day, people have weak blood vessels, like Marfan syndrome, like and other septal defects, and other defects you've heard about. You've had people solicit money to go to India, but the good thing is these things now currently are done in Heart Institute. So people who actually don't have money to go to India, you can still come to Mulago. These things are done there. The other thing is about degenerative diseases. As we grow old, there's something that changes in our body. Yeah. You realize you had a good face, looking face, but with time when it reaches your 60 or 70 years, wrinkles start appearing. You say, hey, what happened? You used to look very handsome. What is happening these days? Whatever is happening on your face, it's also happening in your blood vessel, it's happening in all other organs. So there is somehow organs become a little weak as we grow. This is not a threat to old people, but I want to assure you that as we grow older, the risk for heart diseases increases. So you're going to realize I'm talking about a few things that will tell you that age is a risk factor to most of these heart diseases, mostly hypertension. So it's also part of that. Endocrine, kidneys also play a role in bringing heart diseases. That actually when you have kidneys which are sick, you also can easily get a heart disease. The other thing is the karyotype. The karyotype, we talk about the genetics. If your father and your mother have hypertension, trust me, chances of escaping it is very low. Yeah. So let me rush into hypertension because time is going to be against us.
Yes.
People
we have
always
about 17 minutes.
Yes, people always talk about pressure. Pressure is not a disease as per se. I want to correct it from there. No, the disease is high blood pressure or low blood pressure. Pressure, it's just a little language people use just to use the word. But it's either high blood pressure, what we call hypertension, or low blood pressure, what we call hypotension. And per WHO definition, it is defined as persistently resting blood pressure of greater than 140 over 90 at least 2 measurements apart, with a seated at least 2 to 3 occasions, 1 week apart. So it means you go in a hospital today, they take your blood pressure. They tell you your pressure is 140 and over 90 and above.
What is the 140 and what is the 90?
The 140 is a systolic pressure. Is actually divided into 2. There's systolic. Systolic is that pressure when the heart pushes blood. Now we measure that. what is it? It shouldn't be going above 138.
Okay.
Now, then there's a time when the heart is resting to allow to fill the chambers, what we call the ventricles. So blood is coming back from whatever it's coming from the body, trying to fill, as the heart is resting for another ejection, to push again, to feed all other cells and body tissue and organs. Now, that's what we call the systolic blood pressure and the diastolic blood pressure. Now, the 90, the lower one is called the diastolic blood pressure. So those are the ranges. When you go and you do your blood pressure values, you realize they will give you the upper value and the lower value. Now, in the same process, those are the values we shall give you, and they're the ones we shall use to say, you know what? You have high blood pressure. And for those reasons, sometimes it should be taken more than once or twice in a week to say, you know what? You realize you have high blood pressure. But above certain values, we shall say low. 160 to over 100, we take it more than 2 times in different phases, and it's persistently high, we shall say you have high blood pressure. You're getting my point.
Yes.
Now, just rapidly, I want to classify hypertension. Hypertension is classified into normal. The normal one is 110 to 138 over 70 to 89. When you are there, we say you are still normal.
Okay.
And every part of every level we get, it also helps us in the treatment part of it. Now, there's what we call pre-hypertensive. If we find you around 120, 139 over 80 to 89, we call you pre-hypertensive. You're almost heading to hypertension. Take caution. It's like you're actually on your traffic lights, they're telling you yellow. Take caution. Keep on monitoring it. If you are to be more serious, at that stage, that's when you actually add in more emphasis on doing your preventive medicine. That I'm not going to put a little more time about as I'm trying to run through this.
Yes.
Because that's the gold standard. That's all of us what we should be fighting for. We don't want to have to wait to be on the other side of the line and you start fighting when the battle is already late too. So if you're still in the pre-hypertensive and normal, you still have chances of fighting it and you're not getting hypertension. Now, we have hypertension stage 1, where it's actually 140 out of 159, out of 90 and 99. That is stage 1. It means you're already hypertensive, and that's hypertension. Now, we have stage 2, which is 160 out of 160 and above, and greater than 100. That is stage 2. And mostly that one is a big problem. We call it hypertensive urgency. The pressure is high. It is mostly on a stage of destroying your vital organs. Your brain is at a risk of getting stroke. Your eyes at a risk of unable to see. Your retina can easily detach, or you get a hemorrhage. Because when this blood pressure is, why is it really so high? Why should we say find it's high pressure? Ask yourself, what exactly goes with blood pressure? Now, I'm going to just use a very lay language that people use. I realize that in Africa, mostly Uganda, we are farmers. And we used to spray. If you don't have cows, you have tomatoes. If you never use tomatoes, you've ever sprayed weed. Now imagine you have your spray pump. And the stone goes into the nozzle of your pump. The energy you put in to use to push, you require a lot of energy.
Yes.
Now this explains one of the symptoms when you actually start hearing your heart. Not hearing, but feeling your heart racing. Again, I'm pretty into see. I'm feeling my heart is racing. My heart is racing. heart is racing. Why? It means it's trying to fight harder, to put in energy, to push blood to the last toe, to the last part of the brain, to the last part of your finger, so that it can reach. Because it has realized there's an obstacle in between. But however much there's an obstacle, it has to do its work. In the process, small blood vessels that are not used to those kind of pressures, we call them capillaries. They break or rupture. And when they rupture, it means the important part that you require to take nutrients and oxygen is going to spill into the tissue. So those capillaries help to pull out the nutrients and the oxygen to serve the cell. This time, blood is just pouring. Now, when it pours, you do not get the value of that blood. In the process, in some organs, like the vital organs, like the brain, it pours, you get stroke, you get paralysis, you cannot really do anything for yourself. You find you need to be put in pampers, you cannot really write, you can't really present anything, and you're just there. So it's very important to keep these values into normal. Hypertension, it's associated with most of the complications. As statistics say, I'm going to be very little faster, that 1.13 billion people are suffering from hypertension.
Wow.
And almost equivalent the same number, people die because of cardiovascular-related diseases and hypertension. And what is hypertension? As I told you, hypertension, when I say hypertension, it's a medical word, but it means high blood pressure. Pressure is high. So whenever I use, just know it's that. And in Uganda, basically, we have an 11 to 34% people suffering hypertension. Just to make it a little easier, if we are 10 people in this room, count 1, 2, 3, 4, 5, 10. Among the 10 people, 3 and above have high blood pressure. That's a big number. You can imagine if you have a home and you are 10 people, 3 of you are suffering from high blood pressure. It's a big number.
Exactly.
And you cannot really say, we're going to stay silent on that kind of a silent killer. And why pressure? Pressure is a silent killer. If you've had people who are assassinators, people who come from behind and twist people's neck, it's hypertension. The biggest problem with hypertension and why it's really affecting Africa so much, it's because Africans respond to pain. No pain, no going to the hospital. The doctor's going to I can't say that. Why? No, I'm very fine.
Yes.
You do it even if they go and they test it and they find high. So I'm not seeing a doctor, I'm not feeling any problem. Now, the next time you see that person is when he's immobilized. He cannot really do anything. He has stroke, he has eye problems, kidneys are failing, the heart is failing, he has getting DVTs, clots, and all you are treating now are complications. Go to Mulago Heart Institute. The biggest number of people who are there are fighting complications of hypertension and cardiovascular diseases. Go to Chiludo. People are suffering, dying every day because of that. But this, I shouldn't really be speaking this and really make people lose hope in this. We've not yet lost the battle. No, we still have a role to play.
Okay.
And that role to play, I want to take this time to first show you exactly what are the things, before we shift our guns to the problem. Let's first understand what causes the problem.
Exactly.
Now, heart problems, basically hypertension. I'm going to use this word. We call it idiopathic in medicine. Idiopathic meaning that no specific research has shown and attached hypertension to a certain cause. Though we have risk factors, which actually have been gone through, tested, and being exposed to different other things, and they have shown that they cause hypertension. And these things, one of them is family history of hypertension. One of the things that you always see when you go to a doctor, you ask you, "Awama pressure?" We are not asking that problem, that question for formality. No, we need to dig deeper into your family. What are your family diseases? Now, if you find that your father, your mother, your first cousin, your first sister, or your sister, your first biological sister has pressure, chances are high that 50% you may suffer high blood pressure. It's a big percentage, almost half. They actually have, it's just like either you suffer or not. It's really. So if you're fighting, if you have your parent or your cousin sister or your brothers or sisters having that disease, please don't wait for the disease to come. Raise your guns and swords high. Begin the battle now. Now, secondly, obesity. We call it sedentary lifestyle. These days, the dot-com era, we want to move when we are seated in a car. We need to swing in chairs and feel the AC. From there, you call KFC. Hey, bring me some KFC. Hey, I'm sorry to send names here, but chicken. Let me just really sorry. I'm not really campaigning KFC as a company, but I'm just talking about
the food.
The food that we really love to eat. Basically, we love to eat highly spiced foods, salted foods, sweet foods. All these increase our risk of heart diseases by increasing in size, what we call obesity, increasing our lipids within our body, mostly the bad lipids. And the unfortunate part of it, when you leave this place and you're hungry, go to our supermarkets, you find they occupy 90% of what you see. And there's an old saying that has always worked.
There also is it to access. You're walking around, you go through and again, the street.
That's the street, exactly. Chips, chicken, chips, chicken. And it's fancy, it has a good name. You get somebody, girlfriend today, say, hi.
Chips and chicken.
And it's, we go to CJ, and if you don't have CJ, chips and chicken. Tell us, order for CJ. Go tell us, there are those apps which are available. And all they think about, chips and chicken. Chips and chicken. Those foods have a lot of oils, have a lot of fat. And actually, putting chicken aside, red meat is really a bad one when it comes to risk factors. What is the good? Does it mean that we shouldn't eat chicken? Does it mean we shouldn't eat meat? No.
Does it mean that we shouldn't enjoy the chips?
No. We can do it, I think. But how do we do it? Minimize. In health, is what we call homeostasis. Everything has to be put in a balance. Now, our brain is lazy, and it always has pressure for good things, for better things, sweet things. Now, it records that sweet thing that really put your moods up last time. Every time you're stressed, man, it's been a stressful day. Let me pass here and here, I get some chicken chips. Now, it will also remind you that, now, have discipline about your eating behaviors. Eat more greens. I've had the same bunch of people ask me, but our grandfather used to live longer. Yes! They used to rear cows, go into gardens, eat greens, eat fresh foods. These days, the best foods we can get are supermarket foods and
packed foods.
Exactly.
Doctor,
yes.
I realize we cannot exhaust this, but I want to request you on air. You offer us some time next week.
Sure.
So that we rebuild on this topic. I realize it is a very crucial topic that we cannot really just ponder around. We really need to give it more time. Yet our time has really fast spent. Please, we kindly request you.
Surely, I would have to come.
Good. Ladies and gentlemen, we shall start from there next week. But Doctor, what could be your closing remarks as we end today's session?
Yeah, closing remarks for me today. First of all, to my sector, which I love so much, the health sector. I want to take this precious time to request you, all of us, including myself, let us take time to do our work with love.
Wow.
It's very important. And thank you so much, Family TV, for enriching lives. Amen. It's very important.
Amen.
Yeah.
And we are committed to that. So thank you so much, viewer. I believe this is really very, very important. Like we said at the beginning, and like the doctor emphasized, that this is a silent killer. It's not like malaria, where you'll have signs, you feel the fever, you feel the coldness, and then you can go to the hospital. It's unfortunate that by the time some of these non-communicable diseases show up, or the time you start feeling some of these, it's not, I can't say it's already late, but the effect is already in your body. That is why we really need this information, so that you start looking out before it is too late. We need you alive. Edwin Austin Mkalazi is my name. I work with Jonajal and Didmas in transmission, of course, plus Lubega and very many other people out there who make sure that you have this show with all its features.